Hello Rams fam across the globe. This is African Princess Rams here. I'm a mother of 4 handsome boys. I'm a YouTuber based in Kasane, Botswana, in Southern Africa. You guys, I request you guys to observe a moment of silence for the ladies who did not make it out of labor room, and for the innocent souls who failed to survive the labor room, who did not make it out of the labor room due to some complications or any other thing. Let's observe a moment of silence for them. Thank you, Jesus. Thank you, guys. Yeah, guys, today's topic is something to do with motherhood. Like I told you guys, my channel is going to cover a lot of motherhood because I'm a mother to 4 kids. God blessed me with 4 handsome, innocent kids. Today's topic is I'm going to chat with you on how to take care of C-section scar like a pro. You don't want that C-section to give you too much stress. You don't want you don't want it to get infected, to rupture again, to be sent back to the hospital to do some other operation on top of the operation, because we want to live our normal life even after giving birth, because giving birth is a blessing. It's a blessing. It's an honor, a great honor that God gave to a woman. Yeah, guys. First of all, let me try to explain what a C-section is. It's a kind of giving birth whereby a woman is cut. I don't want to say it through the stomach, but it's cut somewhere to remove the baby. There are so many medical reasons that can lead to this kind of surgery. C-section is a major surgery, you guys, so it needs major attention. It needs to be taken care of. It needs to be taken care of. Some of the reasons that I know may cause cesarean section can be macrosomia, whereby the baby is too big to go through the birth canal. High blood pressure, whereby the BP is too high for somebody to survive the labor room. This one, most of the time is done in 38 weeks, because a lady should be monitored throughout pregnancy. I encourage you guys to register your pregnancy before it's too late, so that the medical doctors can know what is good for you and your kids, for you and your baby, not a kid, a baby. The other reason might be post date. Post date is whereby a woman exceeds 40 weeks of pregnancy. The other reason might be the baby is on a breech position. A breech position is whereby a baby is not facing the right direction. It might be because the baby is sitting on, I don't know how I have to explain it, but he's not facing the right position to be given birth naturally. Or the baby is in trans, what do you call it? But the baby is coming through the feet, not through the head as usual. Those are major reasons that can cause C-section. With me, I gave birth through C-section because my baby was too big. He was weighing 4.8 kg, and I was post the date 43 weeks. So the medical doctors So they found it fit for me to give birth through C-section. It was my first C-section. I gave birth naturally 2 times, and this time around I gave birth through C-section. It was in April, early this year in April. Yes, guys. The very first thing that you have to be cautious about when you are going through C-section is that you are going through that life-saving operation to save you and your child. There are a lot of women out there who did not survive natural birth, and they ended up dying because of certain complication, or they ended up losing their babies. So you guys, we have to appreciate the medical doctors for having option 2 of giving birth. Yes, guys, let me take you through. I'm setting a disclaimer here. I'm not a medical doctor. I have nothing. Everything that I'm saying here, I'm saying it because it's what worked for me. And I've seen a lot of ladies complaining about this cesarean section. So I'm sharing it not because it's something medical proven or what. It's something that worked for me. Thank you for that. First of all, immediately after C-section, because when you are going to be cut to deliver, they give you an acupuncture. I used to call it an epidural injection, but I've learned to know that it's an acupuncture, not epidural. So that injection is given through the spinal cord. They just give it through the spinal. You bend and they inject you through the spinal cord. So that's from the breast to the lower part of your body becomes numb, for you not to feel pain during the process. After that, you have to take at least 6 hours lying on your back, not moving your head, not moving your thighs, not moving your hands. 6 hours, guys. A minimum of 6 hours. But I took 12 hours because I didn't want to risk. I slept through my back for 12 hours, guys. And I managed because my medical doctors, they were so friendly. They were taking care of my son. I couldn't move for 12 hours. The other thing that you have to bear in mind is that your head, you should not support your head with anything. You should not put your head on top of a pillow. You have to rest flat on the bed without moving your head, without supporting it with anything. My medical doctor said if you try to support your head, it's going to give you like severe headache, because the blood flow, I didn't ask him why, because I didn't want to make him uncomfortable, but I think it's because the blood flow that time it's not like perfect as usual, because you are going through that medication is going throughout your body, so it has to reach most parts of your head. Yeah, guys, after taking at least 6 hours without moving, you have to get out of your bed. Try by all means to get out of your bed. Yet it's so painful, it's so frustrating, because you are bleeding, you are in pain, you can't stand you can't stand straight, but you have to try by all means to stand up and have your first bath after delivery. Your first bath, you are the medical doctors will inform you how you bath, because by then the bandage is still not removed from that wound. You bath. Don't don't ever try to put water on that bandage. It might cause infection. Don't try to put water on that bandage. It will cause infection, and infection might lead to your wound becoming swollen. We don't want that. After having the first shower, you keep on bathing half of your body, because you can't put water on the whole body, because you don't want to mess with the bandage. Yeah, guys. Then the medical doctor will keep on giving you medication, treating you. You stay there. You listen to the medical. You guys learn to listen to the medical doctors. They are trained to help us. They are trained to do their job. Let them do their job. But if there's any clarity you want to know, ask them. Ask them if they have any arguments. Talk to them that time. That, no, I'm seeing this and I don't want to. I want to know if it's good for me. Yes, guys. After the medical doctor removed the bandage, the very first thing you have to do, you have to take a very warm bowl of water, put some coarse salt inside, and tap onto that wound, tap onto that wound, tap onto that wound, tap onto that wound, until the blood that was around that wound fades. You're going to have to do this maybe every 3 hours or so. After tapping on that wound, don't forget to use the surgical spirit. The surgical spirit is the most important thing right here to watch the operation. You have to tap that water. After tapping the water, you take your cotton wool, you rest on your bed, you take your mirror, tap onto the wound using surgical spirit. I think you know the surgical spirit, this clear spirit, not the purple one. You use the clear spirit. You wash that wound through using the clear spirit, the surgical spirit. I used to do it like maybe 5 times a day, because I didn't want to mess with this. I used to do it 5 times a day. You guys, if you are from the surgery, don't lift anything that is heavier than your baby. Don't lift anything that is heavier than your baby. Don't, because of the acupuncture that you are given. If you're not going to listen to this, and you are going to do the opposite of this, your back is going to give you hard times, you guys. You are going to do this. You are going to repeat this process of washing the wound until the baby's maybe 3 months. Yes, you are hearing me right there. Somebody's wondering why 3 months. You have to take as long as you can, because you want this spirit to penetrate through the womb into your inner side. You know that this operation, it penetrates through your layer, your stomach, into the inside. So you want that spirit to penetrate. Don't stop when the wound has closed. Don't stop. Keep on doing it. Keep on doing it. Keep on doing it. Keep avoiding doing heavy stuff. Keep avoiding lifting big things. Protect your spinal cord, you guys. Protect it from any further injury. We're going to do this. Washing your spirit, washing with the spirit, washing with the spirit. After after maybe a month or so, that's when you can belly bind. Yeah, belly binding is a process of squeezing your belly into a belly shaper or using a duke. Usually in Botswana we use a duke to what do you call it? Go boga mpa, wa e boga, o bona o patsama, to avoid your your tummy being this big and giving you, taking out the confidence in you, because we don't want to blame ourselves for giving birth during but through C-section. You don't want to say it's because of this C-section that I have a big stomach. Hey, what. We want to enjoy motherhood, because motherhood, like I already said, it's a blessing. It's a nice thing. So, guys, this is all what I wanted to share with you today. It worked for me. Through this journey of this YouTube channel, you are going to see how this whole thing worked out. My tummy is not that flat, but it's not that big. It is just comfortable. It's just manageable. And there's there's this stitch, you guys. I think it's where they are tying up. When they are stitching you up, they make a, what do you call it? How about borante, man? A knot. They are making where they are making a knot to cut the thread, and that stitch is so stubborn. It can take a whole month. Keep on using surgical spirit on that stitch until it falls. The other stitches mine fell before 6 weeks, because we go for 6 in Botswana. We go for 6 week checkup. Before I went for 6 week checkup, all my stitches were gone except that one stubborn stitch. I kept on rubbing it with surgical spirits, rubbing the whole wound with surgical spirits until my son was 3 months, you guys. As I speak, my operation never never itch. It never gives me anything to complain about. Yes, my back at times it gets so painful, but not that much. Yo, I forgot something. You guys, I encourage you to take your black molasses to, do you guys know what I mean by crude black molasses? I think you guys know it. You have to take that crude black molasses for your hemoglobin count to go back to normal, because you have lost a lot of your blood through the process, through the surgery. Take lots of molasses. In the process, you are avoiding headache. You are avoiding, what do you call it, acidity. Yes, guys, thank you guys for watching this video. Thank you guys for supporting me. Please, guys, subscribe to my channel, turn on the post notification, comment on my channel, tell your friends to tell their friends to support me by subscribing to my channel. I'm on a way to 100 subscribers before year end. I appreciate your support, guys. I appreciate your comments, your criticism. I appreciate them. I love you guys so much. I'm going to keep on giving you what I know about motherhood, what I know about lifestyle, what I know about traveling, and a lot of stuff. You guys stay tuned. Don't forget to subscribe to my channel, you guys. To my Cameroonian family, my Nigerian family, my Ghanaian family, you guys means a lot to me. I appreciate your support. To Deli B, my Cameroonian sister, I love you. I know you love me too. Thank you so much for supporting me. Subscribe, like this comment, so that YouTube can suggest it to other viewers, you guys. Bye.